Fuck. What's up, man? Let me take you for a little spin, man. Show you what it feel like.
I gotta go make these drop-offs.
Man, you think you're the only one out here working, B? Gotta make drop-offs too, B. Come on, man, get in, man. I ain't taking no for an answer, man.
All right, welcome to the No Cap Podcast. Why don't you go ahead and introduce yourself for the people?
What's up? I'm Dominique. I'm RN, BSN, board certified nurse, neurosurgery, neuroscience, and neurology specialty.
Okay. And how long have you been in the medical field?
I've been in the medical field for probably like 12 years. I've been a nurse for 6.
It's not the same thing?
No, because you can be a CNA, you can be a nurse tech, you can work in the radiology area. So it's multiple areas you can work in the medical field. So I started out as a CNA, which is a certified nursing assistant. Then I went to be a nurse tech. And then when I graduated nursing school, I was RN.
Okay, and what exactly made you want to be an RN? Was it you was a CNA and you wanted to move up, or was it that always the goal?
Well, I always liked science, and then I liked teaching people. So, which is majority of what nurses do is teaching, then mixing in the science, and then of course helping people. So, with all of that being combined, I've always been the caretaker because I'm the oldest sibling. So I've always been like a caretaker of my younger siblings. So that kind of all like went in together. So it actually started in high school when I was in the health occupation program. And it was like the last 2 years of my high school, so junior and senior year, I was in that program. And so we would like go to the hospitals and like shadow nurses and just like see everything that they do. And then your senior year, you get certified in like something. So the first half, like before you get out for Christmas, I did CNA, got my CNA certificate. And then the second half, I did phlebotomy, which is like blood draws.
Yeah.
So when I got out of high school, I basically had I could basically get a job, as a CNA or phlebotomy tech or both. But after out of high school, I went straight to college. So.
Okay. So can you tell us a little bit of what your day-to-day job consists of?
Okay. So it's a lot, of course, but so basically when we get there, of course we get a report. I work night shift. So I've always worked night shift. Even in school, I work night shift. So we get there, we get report, see about our patients, and then, kind of like prep for the day. So like look at your medications, look through the chart and kind of see like what's going on with the patient. Cause like the previous nurse, they'll kind of give you like just a summary. So like if you want like the details, you go through the chart. And then basically I started out like giving my medications and doing my assessment. And of course they need stuff like food, water, ice, the family probably needs stuff like coffee or whatever. And then just kind of go through the day. So like everything is kind of, as far as like medication in our tasks are like already like pre-planned for us. We just kind of like have to time manage it because they can be at like different frequencies. You have some stuff every 4 hours, 2 hours, whatever. So you pretty much just go through your day with whatever you have to do. They have tests. So sometimes you have to take them for different tests and stuff like that. And then at my job, we don't actually have like a phlebotomist who comes and draws our labs for us. So we have to do our own labs. And then, other stuff that happened during the day, like starting IVs, my unit, we don't really have like a lot of codes because our patients come in for like surgeries or seizures or strokes. And so pretty much anything dealing with the brain, the neck, as far as surgeries and back surgeries. So we get like brain tumors, people have like brain bleeds, then like different neck and back surgeries.
Is that kind of like what Dr. Dre just had?
Yeah, so he had an aneurysm. So that's pretty much like you have like arteries and veins, and so like they kind of like they go like a certain way. It's supposed to be kind of like straight, and so they can like have like bulges where they kind of like something sticks out. It kind of look like a pea almost or something like that. And so when you have that, it kind of, if it bursts, it puts you have a brain bleed because blood goes through your veins and arteries. So I'm not sure like what the details was of his aneurysm, but I mean, you can have an aneurysm and be walking and not even really know until it starts to give you symptoms like headaches or.
I thought they was fatal. I thought if you had a brain, I thought they was fatal. I thought that I seen like a movie and this guy mama had a brain aneurysm. She just like fell in her bowl of cereal. I thought it was.
Yeah, like, if they burst and you have a really bad brain bleed, then yes, because because when you have a brain bleed, that's like a stroke. It's like two different kind of strokes, bleeding and not bleeding. So basically just think about if an aneurysm and you have blood going through your veins and then that aneurysm bursts, then you just have blood going all over. So sometimes you can have them in the big arteries or veins in your brain, or you can have them in the small ones where like if it bursts, it's going to be a brain bleed, but it might not be as much blood. But if you have it in like a big one, then it'll be a lot of blood. So yeah, it just depends on if it bursts or not. But I mean, of course, it's kind of like a ticking time bomb thing because you really don't know. And that's the crazy thing about the brain is that it kind of like tries to heal itself, or you'll have like subtle like signs and symptoms, and then all of a sudden it's like,
right. And you will have to know these signs and symptoms to know.
Exactly, yeah. But I mean, it's pretty general. Like, I mean, a headache.
Right, exactly.
It could be just a headache, or it could be a headache because you got a brain.
Like the COVID symptoms, like you just have a cold type shit.
Exactly.
Well, they say Dre back in the studio already, so he must be good. But we probably talk about that a little bit later.
I know he couldn't do his video when he had Justin Bieber.
Yeah.
The one with Drake, and DJ Khaled.
But we kind of gonna get into kind of that later because pertaining like, does your income determine the type of healthcare you receive? So we're gonna get into that a little bit later. So talking about just your day-to-day and all the stuff that you have to do, does any time does your job become stressful, and do you feel like you're being fairly compensated for the work that you do?
I can say pretty much every day it's different levels of stress. I mean, every day you kind of go in there with a mindset of like, I'm taking care of these people. Anything can happen. Their family is dependent on me to take care of them. So you always kind of have like that underlying level of like stress. But then when you have like a sick patient or a very critical patient, of course, your stress level is higher. I can say that, where I work, I feel like I'm well compensated. I've worked at other places in the past that I probably wasn't well compensated. But working in nursing, working in the healthcare field in general, different areas, different states, different cities, they have different access to money or funding, or they just do healthcare very different. Because I started out working as a nurse in Louisiana, and then I came to Texas, and so it's just totally different on how they do things. I feel like I am well compensated, but of course, I mean, some jobs are just gonna be like, you're never gonna get paid enough, you know? Right. So that's kind of like what it is. So it's like you really have to have a passion for it, because the money is never gonna, like make up for it, because it's gonna be those days of patients or family members gonna cuss you out, and you can't say nothing back, or just then. I mean, you gotta think about it being on the other side. The patients are dealing with a lot, and so sometimes you become their I don't know what to say, but you become like their punching bag, basically, because I don't know if they know we can't say anything back, or we just like the only person that they're seeing, or, we're dealing with it. So they might, in a sense, kind of like blame us. I don't know.
Right.
So it's kind of a lot, but I mean, you just have to know pretty much how to deal with it. And that just takes time. As you are a nurse for, over time, you just know how to like deal with certain patients, and when they become kind of difficult, or they become stressed, or they're stressing you out, and just know to take your breaks. And, if you need a breather, just take a breather, because you have a life outside of work,
Exactly.
So, yeah.
Well, talking about a little bit more about that, do they offer anything like as far as counseling? Because I know you guys like build relationships with people that you might see somewhat consistently, and then the next day or the next minute, next hour, they might not be gone, or like you might be cool with the family one day in the waiting room talking, and then the next day they might lose a loved one, and the vibes change. Is that something that you guys have to cope with on your own, or is that something that they gave y'all some type of skills while you was training to get your certifications, or how do you handle that?
Well, I don't remember, like, I'm not gonna say we didn't, but I don't remember like in nursing school having like them teaching us how to like cope with things like that, because you do have situations where like on my unit we have like 5 patients, and so like one of your patients might die, and you have to go into your other patient's room and put on a face like, you know, as if that didn't happen. You know, like you don't get, okay, when your patient died, you can go home, or when your patient died, you get like, you don't have to take care of the rest of your patient. Like you have to keep going. And so I think it's kind of scary because I think you can kind of build up like a wall where like you don't have that connection when someone does die. But me personally, I don't think it really has anything to do with building a relationship with the patient, because I've had patients that I've had for a while and they passed away and I didn't cry. And I've had patients that I took care of them that first night and they died and then I was crying. So it just kind of, I don't know, me personally, I don't know what makes the determining factor, but I think it's just sad overall that somebody losing a family member. So like in my job, we do have like 24-hour like chaplains, or you know, like pastors or whatever. So like they can always come and like pray for you. And then recently with the pandemic, they've offered us like free what am I trying to say? Free
like
counseling. Yeah, counseling. So we can go, and it's I don't know if we get like a certain amount of sessions, but we can go. I don't know if that was the case prior to COVID, but
I said it should be unlimited.
I know I think at first, initially, it was only a certain amount of sessions, but now I think they changed it because I don't think nobody intended that this would go on this long. And I don't think people realize how much stress that like nurses are under and like what all we deal with, because like we do everything, even like sometimes like recommending things to the doctors to like do for the patients, because we really have to advocate for the patients, because like we're the ones that are there like all the time. So yeah. So
what made me ask that question, and we're gonna get into the pandemic next, but I saw it was a famous story about like the head of a hospital in Europe, but it was some cases nationally where nurses and medical professionals were taking their lives like at the peak of the pandemic just from all the stress and all that. So
and I mean, where I work at, I mean, of course it's bad in Texas. I'm in Houston, so yeah, but it wasn't as bad as like other places where like they literally were having like bodies on top of bodies, and stuff like that. So I mean, we're humans, we're not like machines, and I think like some people don't realize that like, because they'll be like, oh well, you don't know like if something's going on with them, you don't know. And I'm like, I've had coworkers that have been like actually going through chemo and still coming to work, you know, or had surgery and came right back to work like right after and still were like limping, you know what I'm saying? Or coming to work. I've seen doctors come to work on like these are the like scooters if they had like an ankle surgery, or coming in with a boot. So it's like, y'all, you don't really know. Like they think that we're perfect. And it's like, no, we go through stuff. Even like when my dad died, I went to work back to work like 2 or 3 weeks later, you know? So it's just kind of like, y'all don't really know, you know what I'm saying? Like what all we go through, you know what I'm saying? They just assume that like nothing ever happens to us, you know? But so I can see how it can be stressful. And then a lot of people were like, quarantining from their own families, you know, like not sleeping in the bed with their husbands or their kids and their wives and stuff like that. So I can see like if you used to coming home every day and like that is your relief, because like my mom always jokes with me about like I'm in the shower for a long time when I get off from work, and I'm like, because that's my relief when I get off. So like I don't have kids, I don't have a husband, so you know that's my relief when I come home. But other people, their source of like, you know, a refresher is coming home to their family, and when they can't do that, it just mess with your head. Or am I gonna be next? Am I gonna get this? Am I gonna die? You know?
Exactly.
Yeah.
So now that we started touching on it a little bit, in your opinion, how dangerous is COVID-19?
I think it's dangerous because it's still developing. Like it's not like something that been around for a while. We know about it. We've been researching it like the flu or the common cold or any other viruses, you know, even that we've been dealing with. So I think it's very dangerous because as time goes on, like we're continuously learning. It's like we're in this huge like petri dish or something. Like we just going through the motions and trying to like figure it out as we go. And along the way, like people are dying. So it's really scary. You know, I didn't even think that it was gonna be this long because when it first happened, I was in Costa Rica on my 30th birthday trip, and we were over there. The people like at the resort kept asking us like, "Oh, is COVID really bad in America?" And we like, me and my friend were like, "Oh, we don't know. Like, we here with y'all." And literally, like, when we were coming back, like the day I came back, like 3 or 4 days later, they were like canceling all flights to like Costa Rica. Yeah. And so we were like, dang, we barely made it. And then next thing you know, at my job, they were like pulling me to like come work in the ICU, or I was working on like the COVID floors and like stuff like that. So I didn't even know. I was like, oh, this is gonna kind of like fade. I was thinking it's kind of like when Ebola kind of like made its little appearance and it wasn't like really around for a while. But I don't know what happened with COVID. I don't know if they really realized how bad it was or how many people over here possibly had it and just kind of got a late start on trying to like, you know, get rid of it. And now they're saying that it's mutated. So I think it's really dangerous. I think people I'm not going to say people need to stay at home because I've been going out, but I can just say like, just be careful, you know, and just be conscious and kind of like make conscious decisions. Like, do I really need to go here? And I mean, at the same time, it's kind of like you only got one life to live. So it's like, do I want to just like, if I am going to die, like, am I going to just die, like standing in the house the whole time? So it's kind of hard because we so used to going out and stuff, but I think it really is dangerous because we really don't know. And it is a virus, so it can mutate. So
right, and I think part of that had to do with, you know what I'm saying, the previous administration had really downplayed it. I mean, the first information that I had got from it was like it was a flu-like virus. And if you know, I'm pretty sure you know, but 200,000 people nationally lose their life from the flu every year. So at that standpoint, a lot of people didn't take it serious. But with you having to go to where people who get infected with this go for safety, do you feel safe working in a hospital during the pandemic? And has the compensation since the pandemic, as far as not just monetarily, but just as far as the counseling or maybe, you know what I'm saying, meals and stuff like that, do you feel like you guys have been fairly compensated through the pandemic?
So like when it first happened, people were sending us food every day. At first it was kind of scary because like they were telling us we were running out of masks and like all this stuff, you know, protective equipment and stuff. So it was kind of scary because like we were like, dang, if we run out of stuff, then like what we gonna do? And then my job started like recycling like the N95 masks where they like sterilize them. And so then we was kind of like, because we're used
just for
to
y'all,
like,
right?
getting a new one every time, huh?
Sterilizing y'all personal masks, not just.
No, yeah, it's the N95. So it's like that one that you use for like an airborne. It's, you know, the particles. So they were like sterilizing them, like when we use them, and then they were like telling us to keep the mask for like you can use your same mask for like 3 days.
Is that true?
Well, I mean, they tested it, so yeah, but like to us, when they were telling us it was weird to us because we were used to like, every time we get a new mask, get a new mask. So when they telling us like keep the mask for 3 days, we like, huh? You know, so it's not saying that it's not true. Yeah, it's true. They have tested it, and it's, you know, it's okay to use that specific mask for 3 days, and then like the sterilization, it doesn't change the actual like mechanism of the mask. It just basically gets this person germs off of it so that somebody else can use it. I mean, of course, I would prefer to like, okay, can you just sterilize like my mask so that I can reuse it? But it's really no way to like do that because my job has like, you know, thousands of employees or whatever that are using these masks. But I mean, you know, it's sterile. It comes in like a little pack. And I think, you know, but I mean, sterilization is fine. I don't think it's a problem. I think it's just in our mind. We were used to doing a certain thing and then we had to change it. And it was like, what, you know? But I think my job, they did a really, really good job of like making sure that we had what we needed, educating us every time things were changing. Because at first they were telling us that the patient had to be on a certain type of precautions and then they changed it. But they were really good about, even now, they still like keeping us updated with like the numbers and like, my job are doing like different research trials with like different ways to treat it, different medications to treat it with. So my job has actually been really good, but my job is also like one of the best hospitals, you know. So they've been doing really, really good.
Okay. So with you had touched on a little bit about at your specific job, you didn't see like the overwhelming people in the hallways and stuff like that. So with that being said, do you feel like it was has been, or it was overhyped in the media in any type of way? Because just me personally, I just had a son, I just had a child, and I had in the past few months I've been in and out the local hospital where I'm at, and on the media they be like it's touching the Black and brown community real heavy, but where I'm at I don't see, you know what I'm saying, the stuff you see on CNN when people are all buzzed up in the hallways. You know what I'm saying? Every
Yeah,
hospital I went to, I've been in and out. You know what I'm saying? They had
yeah,
turned the McCormick place and the Cook County freezer basically into morgues at the beginning,
yeah.
but they never really needed it. So do you feel like it's been overhyped in any way?
I think it probably has been to some extent like made a little bit dramatic, but I think it was kind of out of a fear that we didn't really know what was gonna happen. So let's like hype it up so that way people can get scared and not do the things that they're telling us not to do. And I kind of think of it like in comparison, because like I mean in college, like when I was becoming an adult, I lived in Louisiana, which was like totally different because I'm from Chicago. So it was like a super different like environmental thing. And so like I moved there of course like after Katrina, but everybody around me was telling me like, once Katrina hit and how bad it was, like every time there's gonna be a hurricane, they like amp up like what they tell you, like, oh, you need to evacuate, like they do the most. And then like
Right.
the hurricane is never it's nothing. When the hurricane comes, it's not bad. And he's like, man, we didn't have to evacuate. We didn't have to do this. We went and bought all these groceries, But it's kind of like a thing to be like better safe than sorry,
Right.
And so I feel like that's kind of a little bit of what's going on with the pandemic, because they don't really know what's going on. And I'm just like, I've been like doing my own personal research, like when the Spanish flu first happened and like how, crazy it was,
Right.
and nobody knew what was going on. All these people died.
Mm-hmm.
And I think just like for us, we've never lived through a pandemic, older people with the polio and then the Spanish flu and all of that. And so like, we don't really know. So it's kind of like to us, we're like, man, this ain't real, because we don't really realize that we're actually living through like history,
Right, exactly.
And so that's, I think the biggest part about it is that we don't really know what's going on. So I think there is maybe some level of drama added to it, but I think that it's okay that we do have that amount of drama, because if you don't make it like that, of course we're Americans, so we're gonna do what we want to do. We feel like it's not a big deal. I mean, people still, like going out. I mean, of course, restaurants have to social distance, but if it wasn't made, that serious, and of course, it probably would be worse. So.
Okay, so because I hear a lot on, you know what I'm saying, the news programs or the information they put out for like people in our demographic. Like if you think you may have COVID-19, to first isolate yourself, you know what I'm saying?
Yeah.
So just your personal opinion, what's your recommendation for anybody who may think they have COVID-19?
I think you should quarantine or go get tested. I mean, no matter pretty much where you live, there are a number of free testing sites. They have the rapid test, or they have the antibody test, or you can just get, like the COVID test that takes like a little while to result. So I think that if you, like you feel like you've been exposed, or you hear that you have been exposed, and I feel like you should either quarantine and get tested, or quarantine and just wait and see how your symptoms go. At first they were saying 14 days, but now they're doing like some places are doing 10.
All right.
But I feel like you should, I mean, because you just never know. You don't want to get anybody else sick, and I mean, so I think that you should quarantine or whatever. Even me, like I went to Colorado like last weekend, and so like sometimes at work, like I'll like pull my mask down, just get like a breath, but like I really made a conscious effort to like not pull my mask down when I was at work, because I mean, like I really didn't know, you know what I'm saying?
Mm-hmm.
We didn't really do anything where we were like in an enclosed space, but still it's just the principle, like being on the airplane, and stuff like that. So you just never know like who you've been around. And I like double mask and stuff like that just to be on the safe side. But I think you should, just because you don't want to get nobody else sick. And I mean, just because you're not sick don't mean that somebody else, gonna get sick. So
Okay, and what you touching on the double mask thing, it's a question I have wrote a minute back. So just as far as like you was talking about you guys getting your mask sterilized, for the normal person like me who's been wearing the same mask for the last 21 days, is that even effective for any,
yes, because it will.
I ain't putting no body spray, no soap, none on that mug. You know what I'm saying?
Well, you need to wash it. If you're using a cloth mask, you do need to wash it. And I think that you should wash your mask if you're using a cloth mask. Let's just get that PSA out there because I mean it don't stink.
No, I'm not saying we flip them, you know what I'm saying? Like I'll buy one, but wear it for a couple weeks. But how effective, like you said, you will sterilize them every 3 days.
But
so just for the regular person.
Those are a different kind of mask. It's not a cloth mask. It's like it takes some different type of particles, like it has really, really, really small like pores on it. But you don't need that mask in the everyday environment because they have discovered that COVID isn't airborne. Just like
we have the people who wear the blue gloves all day long, but they wear the blue gloves on the stove, then come back in their car and still have the gloves on the steering wheel and shit. You know what I'm saying?
That is inappropriate. Even when I go someplace and they have a gloves on, I tell them you need to change your gloves because gloves have tiny, tiny, small holes in them, of course. So, I mean, something can still get on your hand. But me personally, I feel like if you're not going to be touching anything wet, like, bodily fluids or anything like that, then you don't need to wear gloves. You need to just sanitize. And if you are going to wear gloves, like we do, in between patients or in between doing certain things, we change gloves. So let's say I go in my patient room and I need to change their diaper. I change their diaper and I have on gloves. I change their diaper. Well, then let's say I need to give them medications too. I'm going to take those dirty gloves off, use some hand sanitizer, clean my hands, and then put on a new pair of gloves. Granted, it's the same patient, but like what I want to put like feces or urine on their IV site or to give them pills that they're going to put in their mouth. So it's the same kind of situation when you out. People use gloves to go to the grocery store, and then, or even the person at the register is like, yeah, you think you're protecting yourself, but then like you putting everybody else at risk because you touching this thing that might have touched somebody, and then you putting that on my stuff. So it's kind of like, no, if you're gonna wear gloves at the register, you need to change gloves in between customers. And like that. And so that's what I think. But and even at the restaurants, you like go through the drive-through and they got on gloves and they been wearing the same gloves. They touch your money, then they done touch your bag with your food. And so it's just crazy. I'm like, in my job, when I was doing like some days I would do the scanning, like to screen people when they were coming in the hospital, and they would tell us we had to change gloves if we touch the person or sanitize your gloves. If you don't want to take your gloves off, put hand sanitizer on your actual gloves, and then you can go on to the next person. So I think that's a whole like problem with the whole infection control like circle or whatever. But at the same time, people gonna do what they want to do. So.
Okay, so before we get into the next part of the interview, I just want to let you know again, this is the No Cap podcast, you know what I'm saying? So no cap, no bullshit. So before we move along, I just want to ask you, you touched on a little bit about changing diapers and feces. Has there ever been a time you walked into a room or a situation where you couldn't contain yourself, like you threw up or you couldn't do it, or you like tell somebody else to do it, or you went home and you was still like, I can't eat? Because I just don't see, like, I see like the doctors, they come in and they do some stuff with some stuff, and I'm like, damn, you walk past and they in the lunchroom eating, and it's like.
So I've never thrown up for anything at work.
Ever had anything splash on your face or anything?
I've had something splash on my face before, which was actually blood, and I did kind of freak out. But thank God that it was a kid, so I was like, okay, maybe it's just their blood,
It wasn't a crackhead.
And it was actually, I don't know. I think I can say this: a lot of accidents that happen in the hospital could have been avoided. So if you do it the right way and not try to do like what we call a workaround, then it probably won't happen. But no, I think every nurse, every healthcare person has like a thing that like creeps them out. And so like to me, it's like doing stuff that has to do with like secretions. So like if they have like the hole in their throat, which we call a trach, and you have to like suction it, and it makes like that noise, like with like all the like cold and phlegm in there. It creeps me out because it's just nasty. Or like even when like patients are like throwing up, and that's because I hate throwing up. And so I'm like, oh my God, like when they throw it up, I'm just like, when they make it like they're gagging up, I'm just like, oh my God. But like in nursing school, they did like one of my favorite nursing school teachers, Dr. Upshaw. She always told us, like, when you go on these patients, you have to fix your face. Like you have to just do right, like put on the face like it ain't even bothering you. You come out, you just like, you know. And so that's kind of how I am when I go. Even all my coworkers like, Dominique, you never do this. I always keep it cool. I'm just like, don't nothing bother me. On the inside, I'm just like, you know. But I mean, I have never thrown up though at work. I've cried, you know, I've been upset, you know, stuff like that, and not cried, just cry because I ain't gonna lie, I'm hood.
That's what I said. I was just thinking about that. Like don't hurt nobody, man.
Yeah, it's like when people cuss me out or something, I get mad. I'm like, I can't cuss them out, you know, or something like that. And so that's why I cry. Or like I've cried because, you know, a patient family member has died or something, like, you know, if the family crying, like I'll like cry or something. Or like we have some patients that have like they have like a certain type of brain tumor that there's no cure for it. So like they come in and they like walking and talking and they normal, and then as time goes on, they like slowly deteriorate. So you
they come in like on their own admission, like I feel like something wrong, and then they don't leave.
No, they leave. And then they like will come back if like the symptoms get worse or something's happening. So like you kind of see them. It's called a GBM or glioblastoma, and there's no cure for it. There's a lot of research to try to cure, but there's no cure. And so they come in. I mean, they come in initially for like maybe like confusion or like headaches or something. And then we find the tumor. And so then as time goes on, of course, you just deteriorate or whatever. And so you see them come in and they like walk in. I mean, of course, they have like some extent of confusion. But they walk in, they talk, and then like as time they just like, and so just watching, like basically watching somebody die is just like not okay. So I could never do like oncology or cancer because you just literally watch them like deteriorate. And I'm like, oh my God, it just kills me. And I mean, my daddy had cancer, so I think that's kind of like a part of me, you know, that gets bothered about that. But at the same time, I just don't want to watch nobody die, like just that fast.
Has it ever been your job to deliver any type of news like that to somebody?
Yeah. I mean, when they first get diagnosed, we do have to go in and tell them, or like if the patient died and the family's not there, you have to call them to come. It's kind of like an awkward phone call, like, hey, you know, your family member had a change of patient status, and then when they come and you have to tell them that they died. Like the nurses, we don't actually tell them that the patient died. The doctors do that, but it's still like we have to kind of like they kind of come in and tell them they died, and then it's kind of like that, and then the nurses are like kind of there to like help them cope, you know, at the time. And so that's kind of like the one of the harder things to do as a nurse. But that's, you know, that's my thing is, you know. But no, I've never thrown up. I've never not walked out and not did something. But I've had coworkers that have, you know, because it's everybody has their own level of like what they can handle. And so, and then I mean, they always give me like the difficult patient because they know they say I can handle it, even though I'm tired of taking care of the difficult patients. But you know, I'm strong now. I'm a strong person. So yeah.
So now you just clinked out a trach, you up in there, all that. Yeah. And it's lunchtime. Do you skip lunch and eat dinner later, or how do you handle that?
I'm gonna go eat for sure.
That can't be normal. That like can't be. I mean, you've been doing it for.
It's kind of like done. I don't know.
Like, you ain't never smelt it on your fingers.
Huh?
I said you ain't never had smelt it on your fingers, like.
No, I ain't never smelled it on my
man. Stuff it. I don't know, man.
No, never. Nothing on my hands, nothing like that.
Okay.
So
okay.
I mean, of course, it's been times that I probably didn't eat at work, but it wasn't because of something dealing with it. It's probably like
me personally, I can't even eat in the hospital or nursing home. It's just like a smell. I can't eat.
Yeah, like, but some people don't eat at work. I mean, it could be like a weight loss thing, or just, you know, not want to eat at night because I work night shift. But I mean, me personally, I don't think I've ever had anything that just made me so, you know, that I didn't want to eat.
Okay. Now, before I get you up out of here, I want to ask you a few questions with, we got like multiple vaccines that's now available on the market.
Yeah.
What's your view on the COVID vaccine? Are you mandatory to take one of them, and do you suggest that me and my family take it?
So it's not mandatory in my job yet. But my job has also was like one of the first hospitals that made it mandatory to get the flu shot. So I'm pretty sure that it's coming. Me personally, I have not got it yet. I'm not saying that I'm not gonna get it because I'm pretty sure that I probably will. Because in my mind, I mean, at the end of the day, we're all gonna die. And I'm not saying I don't think we're gonna die from the COVID. I don't think if anybody dies, they're not gonna die from the COVID vaccine. I just think that my thing is I want to know like how often will we have to get it? Because you know, like the flu vaccine is every year, and you know, like a lot of the vaccines that we got as kids, you get them as a kid, you have to get them ever again. You know, I mean, unless you need like a booster, which would be like years and years later. Like I think I have to get like a booster for like, I don't know, one of my vaccines that I had as a kid, I had got like a booster because they can test your blood and see, you know, like what your numbers are to see if you still have immunity or if your immunity is low. So I have to get like boosters or whatever. I mean, I'm not anti-vaccine. I just think, and I don't think that the COVID vaccine was put out too fast. I just think that, because I mean, you never know like what all the scientists and people are working on. But I think that they need to let us know like how long is this, like how often are we supposed to get this? Because if you telling me I'm gonna have to get a booster shot like every year, I don't really think I want to do that because I already have to get the flu shot every year.
Right.
So I'm like, I don't want to keep like getting shots because I mean, but I mean, of course we put stuff in our bodies every day. I mean, of course I'm drinking liquor right now. We put stuff in our bodies that, can hurt us in the long run or whatever. So I can't really say like, oh, don't do this because, I mean, I do stuff probably every day. I mean, breathing. I mean, I'm probably like slowly doing something that could kill me. So I think in that aspect, but I think everybody should do their research and trust the science because, I mean, science is there for a reason. I do think that, like you were asking me earlier, do I think that, some stuff, I think we just uneasy because of the history of science and just like, thinking about like the Tuskegee experiment, like things like that. And I mean, even now, I think there are probably some things out there that are doing things inappropriately to different communities and they shouldn't. But that's why I feel like we as a community, Black, white, Asian, whatever, we need to be aware of what's appropriate and what's not appropriate. So like people approaching you to get in medical trials and stuff like that, they shouldn't be doing that. And if they are doing it and it is legal, there is a way to look up, is this a legit research trial? And people are offering you like money and stuff like that. That's not appropriate because you shouldn't be getting paid, like
unless
for a medical trial.
Unless it's a stimulus check. No, I'm just playing.
Exactly. Yeah. But you shouldn't be getting paid for like being a medical trial. Like if it's research, it's research, because a lot of research trials.
Man, you shouldn't volunteer neither.
Exactly.
Compensated for your shit.
But some people do deal with different type of things that like they want to know. I think that my dad, whenever he passed away, he actually was in a research trial for stem cell to cure leukemia. And I mean, so it's kind of like if you have like a terminal disease anyway, or you have a disease that's causing you like so much strife that you can't live like a normal life. I mean, like, are you really wrong for wanting to be in something that could possibly cure this or make your life, let you have like a better quality of life? I mean, I don't really think that that's a problem, but I mean, to some extent, I do feel like with the COVID vaccine that they are kind of like testing it to see if it will help. I mean, of course, it had like the percentages, 90% or whatever of curing it or whatever, but it's also the thing of like, dang, can I still get it? But it's kind of like with the flu shot. I mean, you get the flu shot, it's not saying that you're not gonna get the flu. It's just pretty much saying like you probably won't die from the flu. or your symptoms won't be as bad. And so like the way, I've had like friends and stuff that have had COVID or whatever, and like, they're fine now, but they're also saying like along the line that like it can have like long-term effects on like your lungs and your heart and stuff. So I mean, if getting the COVID vaccine means that I won't have like those lasting effects on my lungs and my heart, of course, yeah, I'll get it because I want to live a good quality life as long as I can, you know what I'm saying? But yeah, I think if you want to get it, I don't think it's a bad idea to get it. But I don't think kids can get it. I think the minimum age is 16, if I'm not mistaken. So I think if you want to get it, you should get it. And I think it's not a bad idea to get it. I just haven't gotten it yet. Because I was still doing some research, and like we have to schedule it, and you have to be in line for a really long time in my job. And so I need to make time to get it. And then they're saying like some people kind of have like a reaction to it, which I mean, of course, you put something in your body, and that's my thing too. Just thinking about like putting something in my body that doesn't belong, that's gonna be there forever. Like I'm drinking liquor, but like when I pee, it's gonna be gone. Yeah, but it's like this is gonna be in my body forever. So it's kind of like that kind of thing. But I don't think it's a bad idea because I mean, we're able to live the life that we live to a certain extent because of vaccines.
Exactly.
So I don't think
like
that
you
it's
don't
a
hear
bad
about
idea.
chicken pox no more and polio.
Exactly.
Like
yeah. And I mean, and I mean, like, I feel like chicken pox wasn't like that bad to like get a vaccine, but apparently it was.
I don't know. I remember like chicken pox was like you had to get to be a teenager, you know what I'm saying? Like that was passage the truth, like when I was growing up.
Yeah, and I mean, I actually had chicken pox because I think I was born like.
And in our house, when my sister got it, all of us had to sleep together that night.
Sleep all together,
I'm sure mama can't take out work that many days. I'm sure y'all have to get this shit together.
Yeah, so that's what I think too. I think, you know what I'm saying, I don't think it's a bad idea, and I do plan on getting the COVID vaccine, but I really want them to tell us like how often are we going to get this, because I don't want to have to get a shot like every. And there's getting shots.
Several that you're gonna be able to choose from. So
yeah, they have the Moderna and the Pfizer. There's really no difference like which one actually works better. It's just a difference in like how we store it and the time frame before you have to get the second dose. Yeah, but
that's what I always say. I tell people to just take it. Like I hate when social media make it
into
like
a thing.
People talking about chips and putting it in the black and brown people.
Yeah,
like you said, like, we drink liquor, we smoke. It's better.
And like even when I leave work, and then when I leave work, everybody is getting the vaccine. There's no everybody's getting it. It doesn't matter what color they are. So I don't think that has anything to do with it. I think that some things that hinder the Black community are because we don't go to the doctor. Exactly. We try to do all of these like home remedies and stuff.
Ginger ale, you know what I'm saying?
Yeah, and I think that hurts. Yeah, and I think that hurts us because then by the time we actually do seek medical treatment, it's been going on for so long. And we done got it in our head and like this work and that work, and then it's like, no, that doesn't work. Like this has actually been proven. I mean, yeah, we do have some, like home remedies that do work or whatever, but some stuff you can't treat, you know what I'm saying, like at home. Yeah.
Now I got a whole bunch of more questions for you, but we can't go on all night. So before we get up out of here,
you need to ask. You good?
Yeah, that's what I said. That's why I'm gonna hit the head points. You know what I'm saying? And I intend to have you as a recurring guest when it's breaking news and stuff like that in the medical field. Because like I said, this is No Cap podcast. So if I don't know it, I'm gonna try to go get it from somebody who's better, who's well. You know what I'm saying? So you're gonna be my medical expert. It's free. I can't make sure you well compensated, but.
No, I'm good with getting the news out there. I ain't gotta be compensated.
Okay, so before I get you up out of here, there's a few conspiracy. I'm not a conspiracy dude, but I do like, you know what I'm saying? I don't trust the government, all that goofy stuff like that. So before I get you up out of here, it's I'm not know if you're familiar with Dr. Sebi, but he claimed that there's cures for AIDS, herpes, and a host of other things, and he was able to cure supposedly. Is there any truth to there being cures to these things, and the medical field being aware of it, and it's just because it makes more money to treat it, like the cancers and stuff like that?
I can say this. I don't really think that there is a cure for certain diseases, because I'm gonna tell you this: there are millions and millions and millions of diseases out there, even ones that we don't know about yet. So I don't think that there is a cure. However, I do believe that there are treatments. So the difference between a cure and a treatment means that a cure is gonna go away, whatever, and a treatment means that like it will treat your symptoms and you can probably live a longer life. So I do believe that there are treatments for certain things, like even like with HIV. So like working in the medical field, I told you like 12 years or whatever. Let's say I drew blood on somebody, or I had a needle stick or something like that. I can get tested for HIV, and I can take like medication early on that I can put in my body, and it will like pretty much stop me from getting like HIV, whether the patient tested positive for HIV or not. I could take this medicine and I probably wouldn't get HIV. So now you have the commercials where like they're promoting like gay or lesbian people to like take the medication for HIV or whatever, like to prevent them from getting it or whatever the case may be. And so it's kind of funny to me. I'm like, oh well, I kind of like knew about that was available, but now it's available to everybody. So I don't know what actually goes into that. Is it actually making the medication, the cost? Because if you ever know anybody who has HIV, the medications are very, very, very expensive. Like sometimes like a lot of them, they don't even really like pay for it. A lot of like foundations assist them in paying for their medications because they're so expensive. So I don't know if that goes into it. And I can tell you one thing: people think that the medical field got money. We ain't got no money. Like, I mean, because we have people that come in that don't have insurance. And so we have to treat them, and so that costs the hospital money. Or if you in the hospital and you have what we call an adverse event according to the federal government, like you get an infection while you're in the hospital, you get a pressure ulcer while you're in the hospital has to eat the cost of those pays. And if you ever been to the hospital, you got a medical bill, you know how much it costs. So even me, I had like chest pain at work one time, and I had got like a workup or whatever to make sure nothing was wrong with my heart. And it costed me like, the cost was actually like $78,000. And I was not in the hospital. I went to the emergency room, and then I had got tests. Like I went to the doctor to like get some tests done. I went home with like a heart monitor, and I had to get like some pictures of my heart and stuff like that. And it costed $78,000. But I mean, of course I had insurance, so I didn't have to pay that much, and ended up paying like $700 out of pocket. But I mean, that's just for that. Just think about, we have patients in the hospitals for 3 months. And I just think about how much that costs: the medicines, the paying the staff, paying the doctors, all the medicines they take. We have some type of medications that cost like $30,000, like some type, And so I don't think that it's really they want to make money or whatever, because that's why healthcare in America is so expensive, because everything costs so much. And so I don't think that they're keeping it because they want to keep making money, because are we really making money? You know what I'm saying? Like, I
don't know. It's too much. It's too much math for me. One time they explained like it's supposedly Canada could do this shit for free, supposedly. So I don't know. But you touched on a little bit about it back, about like things like the Tuskegee experiments and stuff like that. So the government hands aren't clean. So is there anything but, you know what I'm saying? Because there a lot of people think, you know what I'm saying, COVID could be the Tuskegee on a major level. So has there been anything since you've been in the medical field that you found out, other than like is that something you found out like after you became a nurse? Or because I know a lot of people don't even know about that. So
well, I learned about the Tuskegee experiment in school because I was a nursing major with a psychology minor. So
you went to an HBCU, right?
HBCU, yes, yeah. Southern University, A&M College, yes. Okay. So I think I learned about it in psychology, and I also learned about it in psychology because of how, like they can mess with your mind and stuff and prey on like people that are they don't know, they have a lack of education. And then I also learned about it in nursing, like in my nursing school curriculum. So I don't, that I can say this, back then they didn't have as many checks and balances for people to do like these trials or whatever. But I cannot truly say that it doesn't go on, you know what I'm saying? Because like, I mean, they have so many, like they supposed to have so many checks and balances. And I mean, right now I'm getting my master's. And so I learned about like doing research trials and what you can and can't do and stuff like that. And so I just think that we need to educate everybody so that everybody can know like what you can and can't do and what these people you really shouldn't, like when you do a research trial, it's certain things that have to be on there. Whenever you sign to be in it, it's just a whole thing. And I think that the problem is that people don't know what we can and can't do, or they get baited with money and they prey on people who don't have money, and then they're like, oh yeah, I get $500 just to do this for 21 days. Yeah, I'm gonna do it. You know what I'm saying? And they don't really know like what's going on or whatever. And so I think that that's really the biggest problem. I mean, of course there are gonna be, I mean, we live in a world of good and evil. So I mean, of course there are always gonna be people that are gonna try to do things that they're not supposed to do, but we just have to continuously like find out what we can and can't do and just be abreast of everything. And if you don't know, don't be scared to ask a question. Don't have pride. And I mean, it's so many. I mean, you can Google stuff. You can ask somebody. You know, I mean, not saying that Google or social media is like the #1 place to go, but you can always get directed into the right place. You know, and I mean, there is good information on the internet. There is good information from people, and I think social media has intercepted that because we always want to go on there and see what everybody else saying instead of going to like the facts. You know,
right. So. Okay, man.
So I don't think that that's the case. I think that us as Black people, we just don't seek out medical care.
I mean, they don't give it like they're supposed to neither.
I'm not blaming us because, you know what I'm saying, because of the things that we have experienced. And I mean, you know, we are the true Israelites. So I think that has a little bit
what you know about that?
I think that has something to do with it, but I'm not gonna say that that's the overall like synopsis of everything, because I mean, everybody is not out to get everybody, you know. So
yeah, okay. Well, I appreciate you for coming on the No Cap Podcast. This was definitely a dope show. I didn't even expect for us to go that long, so I just want to say thank you for coming on. I know you're busy.
Thank you for having me. Yeah,
giving your expertise. Yeah. And like I said, I'd love to have you back on for another show, just to give them, we have different medical news and stuff like that.
Yeah.
And I can get you on the phone, you know what I'm saying? We don't always gotta do it on Zoom, or
time
you in town, you can come in and we can rap.
Right.
So
okay.
Like I said, thanks for coming on. Have a good evening.
All right. Thank you for having me.
All right.
All right.